Thank you for joining me today. In this video, you will learn hydroxyzine. Hydroxyzine is an anxiety medication. The brand name is visceral. Hydroxyzine, I have also case study based on hydroxyzine. A 26 years old female with our case study is a 26 years old female, no significant past medical history, and she presented to outpatient clinic, reported anxiety, increased anxiety over the past 2 months. She's a graduate student experiencing higher academic stress. She denied history of a psychiatric hospitalization. She denied having a substance abuse or illegal drugs. She also denied having a chronic medical conditions. She is not currently pregnant or taking no other medication daily. Family history is notable for anxiety in a first relative person. She presented to the outpatient clinic with a persistent feeling of overwhelming nervousness and restlessness. And she has a difficulty falling asleep due to a racing thoughts. So she has a racing thoughts. She has persistent feeling of a nervousness and restlessness. She has a intermediate heart palpitation during the period of stress. She feels muscle tension and occasional headaches. She has a mild pruritus during the period of a higher anxiety. However, she denies chest pain or short of breath. She denies suicidal ideation. She denies hallucination or delusion or panic attacks. Mental health examination reveal an alert and oriented individual with an anxiety mood and congruent affect. A gait score indicated mild to moderate anxiety. The reason you choose hydroxyzine is hydroxyzine was selected the initial pharmacology intervention for following reasons. The patient anxiety symptoms are situational, intermediate, not chronic or severe. Hydroxyzine provides short-term anxiety and sedation effect without the risk of dependency associated with the benzodiazepine. So benzodiazepine, if you use benzodiazepine, it creates dependency, but this medication don't create dependency. The medication offers a rapid onset of action, so it's quick action, usually for acute symptoms of relief. It may also provide a benefit for a patient anxiety associated with itchiness. If the patient is experiencing itchiness and anxiety, it treats both of them. This medication treats both of them. The patient prefer non-controlled medication and declines a daily antidepressant anti-depression therapy at this time. So she don't want anti-depression therapy, and she don't want controlled substance. That's why she chose this medication. And hydroxyzine was prescribed on as needed basis for anxiety and sleep disturbance. Patient education include medication purpose. Hydroxyzine is an antihistamine that helps reduce anxiety and promote relaxation. You will educate the patient how to take the medication. Take as a prescribed, typically as needed. Avoid exceeding the recommended dose. You will teach the patient onset of the action is expected to be 30 minutes to 60 minutes. Common side effect of this medication, you will teach the common side effect of this medication, which is drowsiness, dizziness, dry mouth, constipation, blurry vision. You will teach the patient safety precautions. You will teach the patient to avoid alcohol and other sedative medications. Do not drive or operate heavy machinery until the individual response is known. Until the patient's response is known, don't drive or operate heavy machinery. Treatment timeline, you will educate the patient treatment timeline, which is the medication is intended for a short-term symptom relief and does not address the underlying anxiety triggers. It's just the symptom relief. You will educate the patient when to seek a care. You educate the patient to seek care when they have excessive sedation, confusion, heart palpitation, fainting, or allergic reaction. If they feel that, they should seek medical attention quickly. The patient verbalize and understanding and agree with the treatment plan. So the patient has to agree with the treatment plan, and they have to show understanding of what you are teaching them. Thus, you will have a routine laboratory monitoring is not required for this medication in young adult, otherwise or healthy adult. However, the follow-up were considered. Labs that you will consider will be renal and liver function, baseline CMP, not required at this time due to a lack of risky factors to be considered if a long-term use is anticipated. So if the patient is trying to take this is short-term medication, but if the patient is taking this medication long-term, you have to assess the baseline of renal and liver function, electrolytes. So you will check the BMP and CMP and pregnancy test. So the pregnancy test already was negative. You will assess the symptoms such as heart palpitation or syncope. You will also assess the requirement for doing the CMP or if they have a liver function disease, or if they have a liver disease or kidney issue. So you will do the liver and hepatic functioning test. You will have a clinical monitoring. You will clinical monitoring include the reduction in anxiety symptoms and improved sleep. Anticholinergic side effects, you will monitor that. You will also monitor cardiac symptoms such as QT prolongation, especially if the new medication are added. If there is a new medication added, you will have to monitor that. The treatment outcome that you are expecting to see will be at least 4 weeks follow-up visit. So you will do the follow-up visit. You will make an appointment after 4 weeks, and you want to know if the medication is working for the patient. You want to see decrease the frequency and intensity of anxiety episode. You want to see if the anxiety decreased, the frequency of the anxiety, improve the ability to fall asleep. You will monitor that. So after 4 weeks, she reported mild drowsiness after the dosing, which she finds manageable and not impairing. No heart palpitation, dizziness. She denied other face effects. She reported using the hydroxyzine 2 to 3 per week, primarily in the evening, because she wanted to sleep in the evening. So the follow-up plan is to continue hydroxyzine as needed at the lowest effective dose. You will encourage non-pharmacology anxiety management therapy, include cognitive behavior techniques, stress management. That's what you want to encourage and teach the patient how to manage their anxiety, and you will encourage them to come cognitive behavior therapy, and you will teach them techniques to minimize the anxiety. Sleep hygiene, you will teach them sleep hygiene. You will teach regular exercise. You will encourage them to do regular exercise if they are capable. You will reassess the anxiety symptoms, medication use frequency. You will see if they are taking the medication more often. That shows they have still anxiety while they taking the medication more often if they don't have it. So you will assess how often they take the medication. Side effects in 6 to 8 weeks, you want to reassess them. You will consider referral to a therapy or initiate the first line long-term management for anxiety such as SSRIs. So after the follow-up appointment, if the patient is not improving and they still have the anxiety, you will consider long-term use anxiety medication or depression like the SSRIs. If the symptoms are worsening or the medication is increasing, that is when you consider and switch to SSRIs medications. Patient instructed to return sooner if they feel that way. If they experience worsening anxiety, heart symptoms, excessive sedations, you will encourage them and ask them to come back so you can assist them more. Thank you for joining me today, and I would love to see you next video, please, if you like the video, subscribe, like the video, share the video. Thank you.